In this video, we're going to cover the MPI quick scan. We do the scan to try to identify and localize general joint restrictions throughout the spine, and then we follow that initial scan with a more specific scan similar to what you guys have already done with your static palpations. So to start our scan here, I'm going to ask my patient to please face away from me, and then I'm going to have a seat behind her. Now in the classroom and in our labs and clinic, your patient will be seated on a stool, or maybe the chiropractic table, you'll be standing behind them. But for the purposes of this video, so you guys can kind of see what I'm doing, we're just going to go with what we've got here. The first step in doing this scan is establishing a contact across my patient's shoulders. So I'm going to do that with my left arm here. And so what I'll do is I'll put my hand on her right shoulder, and then my elbow is going to come up and kind of get some contact on that left shoulder of hers. And then I'm going to add this kind of compressive force here so that I've got control over my patient and can move them wherever I need to. I'm going to use my other hand, my right hand here, and I'm going to establish a contact on the sacrum and the ilium on either side. And so in doing that, we'll start at the PSIS, and then we'll move down to the PIIS. We're going to start on the right hand side, and then we'll move over and we'll do that on the left hand side as well. Once we have done that, we'll move into the lumbar spine, the thoracic spine, and then finally up into the cervical spine. So in palpating the pelvis, the initial palpation will look like this. Again, establishing that contact across my patient's shoulder, kind of a loose, soft fist, or you can use the palm of your hand if you'd like. And I'm going to start at the PSIS and just challenge P to A, drop down to the PIIS, challenge P to A, and then move over to the left side and do the exact same palpation. So in doing these palps, if you guys remember back in the lab, that sacrum sits and it rocks, it nutates and counter-nutates over an axis, that axis being at S2. And so in going from side to side here and from superior to inferior, we're actually bouncing back and forth over and across that axis. We'll move into the lumbar and thoracic spine next. So for that, this palpation, I'm going to have my patient put her hands behind her head and then her elbows forward. We'll establish a contact here, and then I'll have my patient lean forward into me so that I can kind of accept some of her body weight here. Again, we'll use that nice soft fist contact, and we'll come down to L5 and L4, and we'll start with an initial P to A force, feeling for a nice springy end feel. Okay. Now, as we start to get into that TL junction, it's been my experience that we'll start to notice some restrictions as we get in here. So you'll want to make sure that you lean just a little bit farther, and then we'll be able to induce a little bit of extension almost as we apply that P to A force. Now, as you guys are doing this, you'll notice when you start to get into the thoracic spine of the majority of your patients, you're going to start feeling restrictions as we move through with this style of a palpation, okay? The last palp that we'll do for this scan is in the cervical spine. And so it's very similar to what we've already done in labs. You'll use a web contact on your patient's forehead, and in my lab section I said, hey, make sure your hand is almost like the visor of a baseball cap. And the reason I want you to do that is so that your fingers don't wander and find themselves in your patient's eyes. That would be a bad day. So we're going to put that web contact on our patient's forehead, and then we're going to use an index and thumb contact on the articular pillars of the cervical spine. Now, in doing this, what we'll do is we're going to almost counteract our forces. Our patient's head shouldn't be bouncing back and forth and doing this palpation, but we should have this nice little bit of a rocking sensation in that patient's cervical spine as we move from C7 all the way up to C1. So we'll start here in the lower cervical, and just apply force, stair-stepping all the way up in the cervical spine. You might feel some restrictions here. We'll talk about that a little bit more in lab and how to kind of chase down where exactly that restriction is and how is it impacted. Using this contact, we can induce rotations if we need to, flexions, extensions, lateral flexions, etc. To kind of tease out exactly what that restriction looks like. Okay, so this was a video of the MPI scan.